Good morning, everyone. Today, we will be discussing about the most critical aspect of the endodontic practice, diagnosis of pulp vitality. Diagnosis is the foundation of the treatment planning. It means recognizing the patient's problem, identifying the underlying cause, and then deciding on the right approach to solve it. In endodontics, this often revolves around determining the health of the pulp. So, where do we start? It begins with a case history. The patient's chief complaint is recorded in their own words. It provides valuable clues. Then, coming to the nature of the pain. Is it dull or sharp, throbbing or constant? Is it localized or diffuse or referred? What triggers it? Cold, heat, chewing, and what relieves it? Then, these helps us to distinguish between the reversible and the irreversible pulpitis or pain of pulpal and non-pulpal origin. Next, we move on to the objective findings, in which the clinical examination involves visual inspection, percussion, palpation, periodontal assessment, radiographs, and importantly, the pulp vitality testing. Now, let's talk about the pulp vitality tests because they form the core of the diagnosis. Their main objective is to assess whether the pulp is alive and healthy, inflamed, or necrotic. There are two broad categories. The sensibility test. It measures the neural response of the pulp. They rely on the stimulating nerve fibers, especially the A delta fibers that give sharp pain. These include thermal test and the electric pulp testing. Then comes the true vitality test, which are vascular based, measuring the blood supply of the pulp. Since vascularity is the real determinant of the vitality, these are more accurate. Let's review the common methods. The thermal tests are simple and widely. In cold tests, pain that disappears after the stimulus removal suggests that reversible pulpitis, whereas the lingering pain points to irreversible pulpitis. The method includes the use of ice sticks, ethyl chloride spray, or dry ice. In heat test, it is evaluation is done similar to the cold test, and they use warm air which is directed to the tooth, a heated gutta perca stick, or a hot burnisher, or a heated instrument. A frictional heat during the rotation of the rubber disc or a warmer water syringe can also be used. The heat tests are less reliable than the cold test. Coming to the electrical pulp testing, it stimulates the A delta fibers by passing a mild current through the tooth. For the for that, place the electrode on the incisal one third for an anterior teeth, or else on the middle third of the posterior teeth. Avoid contact with the gingival or the metallic restorations to prevent false positive results. While useful, these results can be affected by the operator's technique, restoration, or patient's practice. Coming to the test cavity, it is rarely used today, but it involves drilling the tooth without the anesthesia to check for the sensitivity when the other tests are inconclusive. And coming to the anesthesia testing, it helps us to localize the pain by selectively anesthetizing the tooth until the pain disappears. Moving on to the bite test, this helps us to identify the cracked or the fractured tooth or the PDL involvement where the patient bites on the cotton roll or a toothpick or an orange stick or a tooth flute. And when there is pain on biting, it indicates apical periodontitis. And when there is pain on release, it indicates cracked tooth. In addition to these conventional methods, there are some recent advances. The laser Doppler flowmetry. It measures the pulpal blood flow using the Doppler principle, which gives an objective picture of the vitality. Moving on to the pulse oximetry, it is adapted from the medicine, which measures the oxygen saturation in the pulp using the red and the infrared light. It is particularly useful after the trauma when the nerves may be damaged but the blood supply is intact. Both these methods offer high accuracy, but they come with the limitations such as sensitivity to the movement, the technical demands, or the equipment cost. In conclusion, the diagnosis of the pulp vitality is not just about one test. It is about the combining science, skill, and the interpretation. With accurate diagnosis, we can make a better clinical decision, preserving the pulp vitality when possible and intervene with the endodontic therapy when necessary. Thank you.